Neurotypical communication is a bundle of verbal and non-verbal. So we use language, we use eye contact, we use facial expression, we use body language. And we might use some of those and not all of them, but typically we use all of them when we're communicating. So the main difference with neurodivergent people, particularly autistic people, is they might not use the non-verbal communication, or some of them might not use the language. So we have differences straight away.
For my MA in autism, I looked at the care and support needs of autistic older adults. One of the things I asked the participants about was accessing healthcare. And lots of different examples of their struggles came up. For example, phoning up a surgery and being triaged by the receptionist, and then the receptionist saying, "I will call you back in an hour," or "I will call you back today," and then it doesn't happen. And there's that. So that's hurdle number one, is they said they'd call me back. I trusted they'd call me back. They haven't called me back. And then there's a need to make another phone call to chase that up. And phone calls can be really, really anxiety provoking for lots of autistic people. So that's one part of it. And then another thing that some people found difficult was sort of getting repeat prescriptions, the hoops are needed to go through to get that repeat prescription. And so it comes to the point where some patients give up. They don't get the right healthcare because it's too difficult to get what they need, or they feel they're not being heard or understood. I appreciate it's a system. However, it means that a lot of autistic older adults are not getting the medication, assessment, appointments that they need to help themselves remain healthy.
Okay, so firstly, there's the phone thing. So most GP surgeries require you to phone them to get an appointment, and lots of autistic people, including myself, find using the phone really difficult. It's very difficult to know. You don't know who you're talking to. You don't know what their response is going to be. You don't know what their reaction to what you're saying is because you can't see them. If they put a barrier in your way, like start asking questions that you can't answer, and that's before you've even started to make the appointment. And then when you make the appointment, you have to arrive at the same time as everybody else, and you have to sit in a waiting room with people you don't know. The chairs are always really close together, so people might be touching you that you don't know. There's ill people in there. Like, okay, I might be ill enough to go to the GP, but I don't want to sit next to people who are coughing and sneezing on me. It really freaks me out, and I always feel like I'm going to come away from the surgery more ill than when I got there. And sometimes they keep you waiting for ages. So my autistic world's very black and white. So somebody tells me to get somewhere for 11 o'clock, I get there for 11 o'clock. And if I'm made to wait, or that they say, "Oh, we're running a bit late," I'm like, well, I'll just go again then, because like I was coming at 11 o'clock, and if you can't give me a time that I'm going to be seen, then that's just it. I can't cope with that. And that, I say, that's before you've even seen the doctor.
Well, many aspects are different. So if we start with the first thing that I'm looking for, and that's attention and listening. So we describe their attention levels as monotropic, and that's not a bad thing, that can be great. But it does mean that they are able to really focus on their areas of interest and the things that are top of their mind at the moment. But that then gives us differences. So if they come to the appointment and the one thing on their mind is that they've really got to tell you all these points, they're not going to bother with the bits that you might be expecting, the social niceties. As a precursor, they will just come in and tell you what they need to tell you. So, for instance, the other day a lady came in. She didn't knock on the door. She came straight in. She handed me an envelope with information she wanted me to know, and she sat down and said, right, start the assessment. That was okay, because I know that that's a possibility. It's a huge spectrum, so not everybody would do that, but I know that that was perfect for her. Her monotropic tunnel was taken up with why she was there, and that was the most important thing. So then that had to be for me. Forget the social niceties. And the listening style might be completely different too. So sometimes I describe it as an unusual listening style. So neurotypicals expect someone to look at you, give eye contact, so we know they're listening. An autistic person might find that too much of a challenge, but also they might not even look towards you. They might find it so much easier to look away. So I often use a spinny chair because some of the people who come to see me like to move, and quite often they will spin the chair so they're actually facing away from me. But that's okay, because I know that that's just perfectly acceptable. The other thing that affects their listening is an inability to filter out. So autistic individuals tend to be able to see a whole picture. So filtering out what's important and what's not important can be difficult. So they will be aware of everything going on in that room. So you start to speak and think that your voice is the most important thing in that room, but maybe you're not aware of the traffic going by, the people in the corridor, the helicopter that's just gone over. So the listening style is going to be different, not like a neurotypical listening style. The next thing that we need to be very aware of is that understanding differences are key, particularly when people are under pressure. And they're going to be under pressure, aren't they? When they come to a medical appointment, everybody can't communicate as well as they can in other situations. But we need to be very aware that, again, because many autistic people take in chunks rather than the individual words, we need to be aware that they might not be understanding what we're saying. It's harder too, because if you actually say, "Did you understand that?" they might then say yes. It doesn't mean they do. They might be embarrassed about admitting that they don't. They may just need a longer time to process what you're saying, so they'll know that it will come through in a minute. But also, they might not be able to explain why they don't understand, because that's a higher level language task. So we can't rely on that. We need to be very, very clear. Their expressive language is likely to be different. So, for instance, some might come in and it's an autistic term that autistic people have come up with, but they might information dump. So you might get a lot of information all at once. Conversely, they might come in and only be able to speak to you in 2-word utterances. They might speak fully and freely elsewhere, but because they're under pressure. And you will get those who actually can't talk at all. So for those individuals who know that's a likelihood, we need to be able to have an advocate with them to be able to speak for them. So there's nothing wrong with their expressive language. It's just when they're under pressure, they can't speak. They're in that sympathetic nervous system state of freeze. And we really need to be aware of that. The other difference as well is with verbal reasoning. So again, I'm talking general terms here, but most autistic people tend to be literal. They say what they mean and they mean what they say. Neurotypical people don't. Now, obviously, in your setting, you're not going to be using sarcasm or idiom, but there are things that you say that aren't true. So, for instance, you know when you say, "I'll be with you in a minute," you don't mean 60 seconds. You mean shortly, but actually I don't quite know when, but when I'm ready, I'll be there. But that can be quite unsettling for somebody who expects you to say what you mean. And this can be a massive barrier in communication between the two. It's also the language that we use to find out information. So on a scale of 1 to 10, well, what does that mean? Can you visualize that? What does it mean? So we need to find different ways of being able to get the information that we actually really need.
Historically, training around autism amongst medical professionals has focused on the stereotypical male view of autism, the Rain Man stereotype, the Sheldon from Big Bang Theory kind of stereotype, someone who has very obvious social communication difficulties, may have very fixed and rigid interests, and may have difficulties maintaining relationships. And research and clinical practice is now showing that many autistic people do not present in this stereotypical way, and as a result they can often be missed in terms of a diagnosis, or indeed in some cases even an onward referral to a specialist team who may be able to explore this further. So simply because a person is able to make eye contact and maintain a conversation does not necessarily mean that they're not autistic and do not need a specialist assessment.
Really important points I think to mention are about assumptions and misconceptions. It's really common for people to make assumptions about autistic people based on their misconceptions, based on what little autism understanding there is in society, which is usually based on a lot of outdated ideas or research, and doesn't reflect the reality of what it's like to be autistic and what that means for you in accessing and engaging in healthcare. So I think the only thing you should ever assume is capacity, obviously in line with the Mental Capacity Act. Really importantly is that having an autistic patient is not a learning disability. It does not mean that they are intellectually challenged. It doesn't mean that they aren't able to understand, process, comprehend and make their own choices and have their own preferences. And it certainly doesn't mean that you should speak to someone else who's with them on their behalf. Talk to a person, I think overall there are lots of things I could suggest which would make the autistic experience in healthcare settings better. But fundamentally, I think that they could be applied to anyone. They're small changes in attitudes, the way you frame your thought process and perceptions and perspectives, to be a little bit more open to new information and challenging your own, first of all, recognising and challenging your own assumptions.
One way to avoid this situation would be for doctors and other medical professionals to be open-minded about autism, to think about how autism can present differently to the stereotypes and what they may have understood about autism, to listen to what the person is saying, to listen to their challenges, and most importantly, I think, to note that the person is autistic on their medical records, to flag it up in some way so that every professional that comes in contact with them will appreciate that this is their diagnosis and this may be the reason for some of the behaviours that may in the past have been interpreted as part of a personality disorder.
As with any consultation with autistic people, be very mindful of your delivery, of your speed of speech, for instance. So people can really struggle to take things in real time, and that's especially the case when they're struggling with their mental health and possibly quite overloaded. To help them express their emotions, you might want to consider using alternative means of communication. So perhaps using visual means that might just help them. You could also talk about what actually happened and what was their response. people might find it quite easier to explain what happened after an event. So, for instance, whether they engaged in self-injurious behaviour or whether they continued about their everyday routine as if nothing had happened. And from that, you can get some gauge of how it affected them emotionally.
I think first, the most important thing is by going online. During COVID, we were able to do an e-appointment, and there was lots of boxes to tick. There was lots of questions. You could give examples of what your difficulty was, and then you'd get a call back or an email even, or they would say come in, and then suddenly after COVID, my surgery stopped doing that, and I was like, well, that was really good. That worked really well for us. And now we can't use that anymore, and I don't understand why they couldn't keep that going. And obviously there are some times when we do need to go, but I feel like they could maybe give us a first appointment or a last appointment, so we're not having to wait in a room full of people that we don't know. And also, they need to read the notes. Like, the number of times we go into appointments and they don't even realise that we're autistic. And I have to take my young person who's also autistic and has selective mutism, so they can't speak. But they're not a child; they're an older teenager, and I get told to not talk for them, or I get told to let them speak for themselves. And they can't do that. And if they just read the notes, they would know that. I just feel like that's a really easy thing for them to do. Just make sure they know who's coming through the door.
There is also increasing evidence of physical challenges for many autistic people. In the past, a lot of these difficulties were put down to hysteria or psychosomatic illnesses, but there is a growing understanding that many autistic people will have challenges with their autoimmune system. They may experience symptoms of chronic fatigue syndrome or of ME, or many will have Ehlers-Danlos syndrome, will have joint and hypermobility, which can affect their pain thresholds. It can affect their digestion. It can affect their physical well-being. And whereas in the past these were often seen as a psychosomatic or another way of seeking attention, I think there's a growing awareness now that many of these physical difficulties are associated with the autistic neurotype.
One of the things I don't find very helpful, I find difficult, is if a GP or any healthcare professional would say, Kathy, on a scale of 1 to 10, how painful is whatever it is? And there's no comparisons. So I find that really, really difficult. And I'd probably just go for the middle number, and it might not be a clear indication of how much pain or discomfort I am feeling. Another thing I find difficult sometimes is processing information accurately. I can take things very literally. So, for example, if a GP were to say to me, okay, you've got your back problem is because your spine's crumbling, I might immediately think, it's going to happen straight away. It's not like going to be a progressive thing over a number of years. So I think it's really important for general practitioners to ask their patient what their understanding is of what they've said to them and get them to sort of say it back, to check it out, to make sure that it's interpreted clearly and it's not going to throw the patient into a state of ongoing anxiety about what's going to happen. So, it needs to be really clear.
It's been a struggle constantly this year with the GP, and I understand there's COVID and everything else, but I've I've had 2 leg ulcers, still got one. I've had several doses of antibiotics. I've sent numerous pictures into the surgery, and I haven't been seen once in 8 months of struggling with my legs. Not a single time. You speak to a different doctor every single time that you ring up and need to speak to somebody. There's no continuity as such of any of the care, and no understanding what that does to somebody having to constantly explain exactly the same things over and over and over again. There's also the fact that I have interoception as well, and alexithymia, so I don't really know how to describe what I'm feeling. I don't really know when I'm in pain either. I do when it reaches 11, but if I'm a 7, I don't really realise it. And it often takes my wife to tell me, "Are you in pain?" And I recognise it then, because my behaviour changes around everybody. She can see it in me, but because I can't describe that, or I don't recognise that in myself, I can't describe that to a doctor. Yet probing with proper questions should be able to be seen. And similarly, my wife can spot it. And so if she can, then I'm sure other people can as well.
Well, social communication can be the biggest difference, so can be the biggest barrier when we're communicating with autistic individuals. So neurotypical people, we have a set of expectations, and we alter our communication depending who we're with, what we're talking about. The environment is really, really important to how we tailor our communication. And we have a set of expectations about what we should do and what we shouldn't do in situations. So we get caught up in these social expectations very easily. So then if somebody isn't following that neurotypical pathway in the communication, we see them as rude, or, well, they're not doing as expected. And if people don't do as you expect, that actually unsettles us. But it's the biggest thing. So like I say, the lady who came in and just gave me the envelope, neurotypicals would have expected to come in and say, good morning, had a lovely time, but, I got here fine, blah, 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 sit down and then begin the conversation. She didn't. She just came in and did, basically. And that's fine, because we need to alter our expectation of normal. So, for instance, many autistic individuals will be very honest with you. So it was interesting, last week I had a project that had kept me up most of the night, and the next day none of my neurotypical clients said a word. My 2 autistic clients said, "Libby, you look dreadful." And they were right. But they weren't being rude, they were just seeing it and saying it. But it can unsettle a neurotypical person, and it can put their back up. It can make them prejudge. And that's not right, but that's what we do, because our expectations don't match a neurodivergent norm.
So when we consider autism as a difference rather than a deficit, we need to consider what those differences actually mean internally and as part of the experience for an autistic person. The differences, particularly neurologically speaking, I like to think of them as sensory and cognitive. There is overlap between them, obviously, but if we think about how your brain is wired, for want of a better word, how those systems work and function is a different type of system altogether. It's a completely different process to what is the most commonly experienced by people. So when we talk about the load of information which then has to be processed. Information can be literal facts, words, language, the visual information we see, but also there's the extrasensory information, which is, you know, the sensory experience in terms of how bright things are, how loud things are, you know, what you can see, what you can hear, what you can smell, what do things feel like, what is the whole sensory experience, what is the profile of that experience. Some autistic people might be hypo or hyper sensitive to certain sensory triggers. In order to regulate their experience of an environment, they might be sensory seeking or sensory avoiding. So, you know, thinking about how you cope with something that is unpleasant or distracting, perhaps, you might avoid it by completely removing yourself from it or removing it from your environment. Or there is also the flip side of that, which is where you can drown it out. So you turn one part of the experience up so much that it overwhelms everything else, and that's the only thing that you'd have to consider because everything else is drowned out. I think it's important, really important, to remember that sensory experience is not just external, it can be internal as well. So you think about the external experience, smell, sight, hearing, touch, taste, but there's also interoception, which is how you experience internal sensation, or the internal functions and stimulus. So, for example, needing to go to the toilet, feeling hungry or thirsty, or feeling pain, discomfort. So, for example, I mean, I could be really aware of what my heart rate and blood pressure is doing because of the way I feel inside, and it's spookily accurate. But also, because I don't necessarily recognize when I'm hungry, I have to make a constant effort to eat, otherwise I will forget. Which is a curse of ADHD. Another neurodivergent condition. So it's important to remember that if somebody has one neurodivergent diagnosis, they are likely to have more than one. So dyslexia is also a neurodivergent condition. Dyscalculia, dysgraphia. So these are the people who, if you have a patient who says, oh yeah, I'm dyslexic, you also want to be thinking, their brain functions in a fundamentally different way, which means it's particularly challenging for them to read and write, for example. That might be just one aspect of how their neurology is different. So an autistic person is hugely more likely to also be ADHD or dyslexic, for example. And so to view one condition as a standalone diagnosis, if you like, or set of traits, could be considered naive when the overlap is so great. It might be careless not to also consider, are we missing something else here?
It's also important to note that language might be used differently by autistic people, and sometimes things that might seem very clear indicators of suicidal feelings in non-autistic people are slightly less reliable in autistic people. So, for instance, someone might say, I don't belong in this world. this could be a reflection of their reality and their truth as an autistic person. It's absolutely worrying, and it reflects someone who's struggling to fit in and perhaps very unhappy. But it may not be a clear indicator of suicidal feelings in the same way as it might be in a non-autistic person. Likewise, if someone uses the word hopeless, it may not have quite the same emotion-laden feeling as when it's expressed by a non-autistic person. It might be used in a more pragmatic word choice sense. However, we should always err on the side of caution, and this is where it's so important to know your patient and know what their normal is, and know the way they normally talk and the things they normally say, and to really dig a bit deeper into what's going on.
Navigating through the healthcare system can sometimes be very difficult for people who are neurodivergent. I think we need to be very open about how you perceive things. Just let the receptionist know this is how your brain functions. You do get anxious if you do not have a call back, and be very clear and transparent about it. And there are reasonable adjustments we can do about it. For example, if you need an appointment, ask for the first appointment of the day so that the clinician doesn't run late and you will be seen pretty much at the same time. If you need a prescription, always look at what the practice's website says. If it says 48 hours, wait for 48 hours, or if it says 72 hours, wait for it, and ask them what is the process for the call back. What happens if it doesn't come in 72 hours? Do you ring back, or is there another system which will inform you what had happened? So being very clear and transparent about your needs helps the other person to understand what the expectations are. Because otherwise, every person is the same at the other end of the phone. We do not know what the person's needs are at all. So be very clear and transparent. And I think, having that diagnosis or having that understanding helps us to navigate through the system a bit more easily, not just for yourself, for the others as well, and help you with your needs.
I mean, it just made everything so much easier being able to do the whole thing online, because there was a box to just give an example of what your symptoms were. So, for example, I go open water swimming a lot, and I get ear infections because I've got bad ears. And I knew I'd got an ear infection. So I just filled in this little box and said, I've got an ear infection. I've had loads of ear infections before. I know what it is. Can you give me some antibiotic spray? And I got an email back, yeah, no problem. Prescription will be at the chemist in 2 hours. And I just thought, wow, that was amazing. How brilliant was that? Because, I understand there are conditions that people do need to see a GP about. But if it's something that you get regularly, or something that you need a bit of help with, it was just so much easier just to fill in that form. And I had another. My young person had tonsillitis, and we did the online thing, and then we got a call back, and then the GP had got a set of questions to ask, and he said, if we tick 4 out of 5 boxes, then yes, it's very likely that they have tonsillitis and need antibiotics, and that was the case. And again, the prescription was at the chemist within 2 hours, and it was just so easy. And I just don't know why, we're not making more use of this stuff. And I know some people will hate it, and, I get that. And if people want to ring up and make an appointment, go and sit in the waiting room, that's fine. But we should have a choice. And we know now that it can be done. That's the thing. Before COVID, we didn't know that this stuff existed. And maybe some of it didn't exist. Maybe it came about because of COVID. But now we need to build on it, and we need to accept that for some people that works better.
Well, for the purposes of today, I actually interviewed 25 older adults, some of whom have had some really bad experiences. So one lady, she's got a PhD, she's terribly bright, but 2 weeks ago had a meltdown in her GP surgery and ended up with her head under the receptionist's desk. Awful situation, absolutely awful. And at the end of that situation, she was expected to apologise. but it was the environment that had caused that meltdown, the environment that had made that happen. So actually, we should have been apologising to her. But I'm going to read them so I do it justice. So this is a summary of what they all said in a concise fashion. I'm still listening to you, even if I'm not looking at you. Please don't force me to make eye contact. I might make too much eye contact because I don't know when to stop. If I don't reply, I'm not disinterested. I just don't know how to respond. If I'm non-verbal at the time, please respect that. I interrupt people when I'm excited or have something really important to say, and I don't necessarily realise I'm doing it. Please be patient. I need time to process and think about how to respond. My facial expression might not match my emotions. Please make it clear when the conversation is over, because I might not know. I don't have a good grasp of social cues, but please know I am trying my best. Please state your thoughts clearly and concisely. And please specify your intentions at the start of the session, because I might not be able to read your intentions. And the last one, I won't be able to hear you if there's background noise. So that was a real summary of the things that they were telling me. But mostly they felt prejudged and devalued. So one lady said she can tell as soon as she tells somebody that she's autistic how their attitude to her changes. And she said, you know, treat me as an equal because I am, and she is. If we saw it as more of a cultural difference, that would make a huge positive effect. So if somebody with an obvious cultural difference came into our room, maybe a lady in a full burqa, we would know to try and make things as easy as possible for her. We would try to understand her differences. We would make those accommodations as standard. But that's really what we need to do for our neurotypical population. If we look at the work of Damien Milton, so in his Mismatch of Salience, he wrote about the double empathy issue. And this is key because the communication breakdown, it's never one-sided. It takes two. So while we are struggling to understand the autistic communication, they're struggling to understand ours. But it is double. It's double responsibility, that double empathy issue. And we need to know about that. And if we look at Temple Grandin, when she talks about, I'm autistic, that's different, not less. And that's really what we need to embrace. And we also need to embrace the idea that when you've met one autistic person, you've met one autistic person. So we really need to actually embrace the sorts of things that I was just talking about that those people had told me. If we embrace those as the norm, it would actually benefit the whole population.
A lot of autistic people find the concept and the process of waiting incredibly difficult. They absolutely understand the need for and the rationale for queuing and waiting your turn, but the whole concept of waiting can be a really difficult experience. It's always really helpful to know how long you're likely to wait. So, for example, if somebody is sitting in a waiting room or they're checking in for an appointment, if clinics are running late, let people know clinics are running late. You know, I know it's not unusual to be sat as a patient in a GP waiting room to be called in 45 minutes after your appointment time, not knowing whether you've been missed, whether you checked yourself in at the self-check-in properly and that's actually registered and they don't know that you were there, or, you know, have you got somewhere to go? At what point are you going to have to say, I need to reschedule and leave? Or the more information you can give, the better. It's not always practical to give exact amounts, you know, an exact waiting time. It's not possible. But if you can say currently, or the last patient went in 35 minutes after their appointment time, that gives you an idea. You can be pretty confident you're going to be waiting at least 30 minutes. And then if you need to take some time out of that environment, you can come back to it in even 20 minutes time. You know, just this little bit of leeway for people. Why wouldn't you do that? That's just, it's kind, it's caring, it's humanity, you know, to be helpful. And isn't that what healthcare is for? To look after people. Expectations are difficult to manage for autistic people. When you don't know what's expected of you, for example, what the process of checking into a GP surgery is, and then what the process of being called for your appointment is, that can be very anxiety inducing, because you don't know whether you're missing something or whether you're doing something incorrectly, or should I have done something else before this? You know, have I missed a sign or something? When we don't have the information readily available, something that might be a social norm to most people will and does often go unnoticed by someone for whom that is not a norm. So one example I found is that two different GP surgeries, once you've checked in, either face-to-face with the receptionist or through the self-check-in machine, you would sit down in the waiting room and wait for your appointment. The first GP surgery was smaller, and the GP would physically stand up, open the door to the consulting room and call you through by name and look at the people in the waiting room. The second GP surgery is a much bigger practice, and some of the consulting rooms are down corridors, and I assume it's to save time and effort for people standing up, walking along corridors, shouting names, and then walking back. I can understand why that's a time-saving process, but they had a screen which would make a quiet beeping sound and then display the name and the consulting room number of which patient and which room to go to. And this can be a really, really difficult situation to be in. If you are expecting someone to turn up and shout you by name, and you don't realise that actually you need to keep an eye on that screen, you're going to be filled with anxiety that you're going to miss the appointment, because first of all, you have to realise that there is a screen and that's how the system works. And if nobody's told you that when you check in, either electronically or in person, then how would you know that? Again, it's an assumption. And then also, if you factor in, you don't know how long you're going to be waiting. So your appointment is at 10 past. You're thinking, oh, excellent, right, it gets to 10 past and you're looking at that screen. You look away for a couple of minutes and get distracted and then go, have I missed my name on the screen? Did I miss a small beep because there's kids playing over there and there's a lady having an argument with a receptionist over there. There's a phone ringing over there. I could really easily have missed that little beep. I might not have seen my name. I don't want to miss my appointment. But then clinic is also running 40 minutes late. So you sat there for 40 minutes trying not to look away from a screen. When actually, if you had been told in the first place what the system was, you'll need to keep a check on the screen. And if you do miss your name, then, you know, someone will call you. You won't miss your appointment. That would be really helpful. It's just a really small thing which can reduce anxiety, not just for autistic people, although, you know, that's something that is more likely to affect autistic people, but that would reduce stress for a lot of people who are already in a waiting room where you go when you are unwell. So people are already experiencing a level of stress by having to go to the GP as well, whether they feel unwell or are having problems with treatment plans or appointments. You know, just little things like that can make all the difference. Or a sign which explains what the process is. Or just a few words at reception when you check in. To assume that that everybody understands what they should be doing is really easy to do. People do it subconsciously all the time, and you don't realise unless your brain works differently, and that doesn't work for you. So when a receptionist, you might check in, for example, says, "Can I help you?" To somebody who thinks literally and logically, I might think, well, no, I need a GP. You can't help me. I need to see a GP. So they might say, "I've come to see the GP." Because the question, "Can I help you?" Somebody who thinks differently is already a couple of steps ahead in that conversation. They're going to say, "Yes, I'd like to check in for my appointment." They might think, "Well, I've come here to see the GP, so no, you probably can't help me." When actually, what you could phrase things a little bit differently. Do you need to check in for your appointment? What can I help you with? You know, is there anything you need? Or, you know, or when someone assumes that you know what piece of information they need, they'll say, "Okay, so what's your name?" And I might say Laura. And then they'll look at you and go, "Yeah, and what's your surname?" Or you know, they'll look at you and say, "Right, I'll need your details." And then you think, well, which details? Because sometimes people want to search by your date of birth, or they might search by your surname, or they might search by your address, or there are a whole load of different possibilities that affect what information you need in order to engage in the appropriate or necessary response. So, and I think most of all, to just be kind. If somebody looks a bit lost, or if somebody looks a bit anxious, or if somebody is being difficult, for want of a better term, I know it's a phrase that's often used, or kicking off, or expressing some sort of dissatisfaction or distress at an experience that's happening for them at the time. They're not doing it, whether they're autistic or not. They'll be doing it not to give you a hard time, it's because they are having a hard time. And what people need in that situation is not more confrontation, it's support and kindness, and say, "How can I help you? What do you need? Do you need 5 minutes?" Or, you know, even if you don't know how to help, or you don't know what to do, just explain, you know, and say, "I'm not sure what to do right now, but hold on, and I'll get somebody who does," you know, or "I'll find out for you." You know, people who have been waiting months for appointments will say, "I've been waiting months for my appointment and I haven't heard anything." And it's like, "Oh, well, the referral was sent on this date." It's like, right, well, that doesn't help me. You know, do I need to chase it up? Or do you need to chase that up? Or was it sent to the right place? You know, because we all know that systems fail sometimes. Not everything goes to plan all the time. It's not necessarily somebody's fault. It's not about blaming people, but it's about just trying to help and work out what it is that's a barrier to a successful interaction and engagement in healthcare. And then just problem solving to try and overcome that barrier, because it can just be something as simple as a sign that explains what is the process. So just be considerate and kind.
Quite often, and this is from my experience and my young person's experience, is that when people go to the GP with various symptoms, I don't know, headache, stomachache, joints problems, all sorts of different things, we just get told, oh, it's because you're autistic. And then that, that's it, that they think that that's okay to accept that. But yeah, we are autistic, but we have other conditions as well. So, and if an autistic person is getting headaches all the time, yes, it might be stress because they're autistic, but it might not be, it might be something else. And, it's unfair to just say, oh, it's because you're autistic, because yeah, it might be, but equally, let's investigate and see if we can help in some way, because we might be able to get rid of those symptoms and make life just a little bit easier.
Austica's crisis booklet is a really helpful resource around communicating with autistic people in distress. It's aimed at younger autistic people, but it's got a lot of very good generic advice. And one thing that might be very valuable to your patient is to express that you know this is a really difficult time and a really difficult conversation to have. Make sure they feel safe, that you're not judging them, and if they need to take a bit more time to respond, that's totally fine.